Hello, welcome to Acharya Nidana Academy. In this particular video, we are going to discuss one of the essential points which are necessary for the interaction with the client or patient at the hospital or at the bedside. Maybe in the OPD level or maybe in the IPD level. So whenever if you are taking the history, so you are going to have initially you are going to have an interaction with the patient so that we are going to take some of the initial informations related to patient. So that means name, age, gender, duration, etc. After having the elaborate description, we are going to ask what are the major presenting complaints. So that particular complaint should be mentioned in patient's own words. The reason is the patients may have the overall this information related to their presenting complaints, and that should be mentioned in the chronological order. After the chronological order, so that is we have to ask the history of present illness, which is the topic of discussion today. When you think about the history of present illness, so that is actually nothing but elaborating the presenting complaints. Say, for example, the person may be having chest pain. Elaboration of chest pain in relation to the character or the duration or the radiation or the situations where the person is going to get the particular chest pain, etc. That is the what we say that elaboration of chest pain or elaboration presenting complaints. That is the main issue of history of a present illness. If the person is having the three presenting complaints, all those presenting complaints should be analyzed in all these points of a history of present illness. If the person is having 5 symptoms, all the 5 symptoms has to be or have to be analyzed regarding the points of a history of present illness. The points to be evaluated are onset, duration, severity, course of the symptom, aggravating and relieving factors, and the negative history. So these are the points that have to be evaluated if the person is having the presenting complaint, or if the person is having the pain. In that particular situation, the details of the history of present illness differs a little bit. That is onset, duration, location, radiation, character of the pain, severity, course of the symptom, aggravating and relieving factors, and negative history. These are the points that have to be elaborated as far as the pain is concerned. When you think about the history of present illness, little bit elaboration. As already mentioned, when the person is having the 2 symptoms, all those 2 symptoms have to be evaluated based on the onset, duration, location, radiation, character, severity, course of the symptom, aggravating and relieving factors have to be written. If the person is not having the pain, then onset, duration, severity, course of the symptom, aggravating and relieving factors, and negative history should be written. When you think about the onset, So basically, three types of the onsets may be possible. It may be sudden. For example, a trauma is being happening, maybe hitting to the back. Immediately after that, he is going to have the presenting development of the pain, such as pain abdomen or the backache, etc. In that particular situation, you are going to say it is a sudden type of pain, or otherwise gradual variety. In the sense, the person is unable to notice the pain initially. Afterward, he starts to notice he is having the little bit, what do you say, that increasing in severity. The person is having the pain. For example, joint pain. Initially, he may not be able to notice the joint pain. After certain days, he starts to notice the joint pain little bit severe. That means in the discomfort wise, the person will be having the increased order of discomfort as such. And third category, insidious. The person may be having the pain, and development of this particular pain will be gradual, but its consequences are serious. For example, the person is having the pain in the back, and it started with radiation from the loin to groin. After that, he's starting with hematuria. That means the blood mixed urine. So this could be an insidious onset, wherein the person may have some kind of serious consequences. So likewise, onset has to be mentioned either for sudden, gradual, or insidious. Then duration has to be mentioned along with soon after the onset. That is in terms of the days. Sometimes the person may have the pain for months, sometimes years together. For example, pain abdomen since 1 day, or vomiting since 3 days, cough since 5 days, or sneezing since 1 day, or otherwise the joint pain since 3 months, or fever since 6 months on and off, or otherwise the loss of strength since 3 years, or otherwise reduced movement of the limbs since 4 or 5 years. So like that, duration of the presenting complaint has to be written soon after the onset. Afterwards, if the person is presented with pain, then location of the pain, radiation of the pain, and character of the pain are important. When you think about location of the pain, abdominal pain, in the epigastric region, we are going to notice what are the organs present in the epigastric region. We are going to list out these particular organs. If the person is having the pain in the left hypochondric region, we are going to list out the organs of the left hypochondric region, such as spleen, or left kidney, or splenic flexure, etc. We are going to notice, or pancreas. We are going to notice regarding the left hypochondric region. If the person is having the pain in the retrosternal region, we are going to list out the organs present in the inferior mediastinum. If the person is having the pain in the head or headache, we are going to notice or list out what are the organs may be responsible for the headache as such. Afterwards, radiation of the pain. If the person is having the pain in the epigastric region, radiating to the left back through the left side, the most common organ affected will be pancreas. If the person is having pain in the epigastric region, radiating towards the retrosternal region, the most probable organ afflicted could be esophagus. If the person is having the pain which is radiating from loin to groin, the most probable organ afflicted could be ureter. If the person is having the pain in the umbilical region, afterwards the pain is shifting towards the right iliac fossa, the organ probably afflicted will be appendix. If the person is having a pain in the epigastric region, afterwards, immediately the person is having the radiation towards the right iliac fossa, probably there may be a possibility of a peptic ulcer perforation. It could be an emergency, medical or surgical emergency. So like that, the radiation of the pain will be helpful in making the diagnosis. Let me give you one more example. If the person is having the pain in the right hypochondric region, radiating towards the inferior angle of right scapula, the organ afflicted could be common bile duct. So like that, the radiation of the pain will be helpful in making a clinical diagnosis. Third aspect regarding as far as pain is concerned, character of the pain. Suppose if the person is having pricking type of pain, that is usually suggesting that the person may be having the inflammatory condition. If the person is having the burning type of pain, then that may indicate, specifically in the epigastric region, that may indicate hyperacidity syndrome. And if the person is having the squeezing type of pain, again, that is usually indicative of what you say that spasmodic type of pain, which is usually being observed in case of colic as such. Colic type of pain, where the what do you say that the hard structure is restricting the movement of the hollow viscera. So like that, the character of the pain will be helpful in the diagnosis as such. Next comes the severity. Basically, three types of severity are being mentioned: mild, moderate, and severe. When you think about mild variety of pain, the person is in a position to do his routine activities in spite of having the pain. That is usually categorized under mild variety of pain. Suppose if the person is able to do his routine activities only after taking the medication, then it is categorized under moderate variety of pain. If the person is having the severe, in the sense, whatever may be the medications are being taken, if the person is having the persistence of pain, then it is indicative of a severe variety of pain. When you think about the severity, it is usually a relative term as far as the suffering individuals are concerned. That means, depending upon one's nature of the, what do you say, the physique or the strength of his psyche, that the severity may be varying. That is mild, moderate, and severe. Then comes course of the symptom. In the sense, whether it is improving, worsening, or persistent. These are the three course of the symptom that can be mentioned here. When you say about improving, in the sense what? Suppose if the person is having the pain since 4 days. Initially, he is having the mild variety of pain. Now, he is having the severe variety of pain. That is indicative of a worsening variety. On the first day, he is having a severe variety of pain. Afterwards, he is having a mild variety of pain. Then it is indicative of improving the course of the symptom as such. If the person is having the day 1 severe variety of pain, present day severe variety of pain, that is indicative of persistent course of the symptom. Afterwards, aggravating and relieving factors of the presenting complaint. Suppose if the person is having the consumption of oily substances such as pakoda or gobi Manchurian, if it is worsening the pain abdomen in the epigastric region, definitely. So that is indicative of specific diagnosis itself. If the person is having a relief from the pain by taking the warm water or milk or antacids, that is again confirmatory of what do you say that the presenting complaint of what do you say hyperacidity syndrome. Both aggravating and relieving factors. That's how they are helpful in making the clinical diagnosis. Then comes the negative history. If the person is having the chest pain, so you have to notice the other associated complaints as negative history. Suppose if the person is having the absence of cough in the presence of chest pain, probably this may rule out either cardiac diseases as well as respiratory diseases. Whereas cough in the absence of chest pain, that may indicate either early respiratory illness or otherwise the person may have upper respiratory tract illness as such. This is how, so the negative history is helpful in making the clinical diagnosis. Absence of fever suggests the absence of infection. That's how the history of present illness is helpful in the clinical or documenting the case history. Certain examples. The person is presented with chest pain. So this may be the probable way how we are going to write the history of present illness. A 27-year-old male patient, a resident of so-and-so, having an occupation of agriculture, was apparently healthy or normal since 20 days. So here the word apparently healthy refers to the wordings of the patient, not the wordings of the clinician. They are thinking of themselves as apparently healthy or said to be healthy. So after that, he suddenly developed pain in the retrosternal region, which is non-radiating, picking type of pain, moderate in severity, improving, aggravated by consuming spicy substances, chili, and getting relieved by taking antacids or kamadugarasa. So this is the case history. So here the onset has come. So after that, the duration was 20 days, that has come. Then comes the location of the pain, that is the retrosternal region has come. Radiation, that is non-radiating, that has come. Character of the pain, that is pricking type of pain, that has come here. Moderate in severity, severity has come. Improving, course of the symptom has been documented here. Aggravation, that is aggravating factors, the spicy substances, chili, etc. That is documented here. Relieved by taking antacids, that is relieving factors has been mentioned. After that, the negative history. The patient is not having the pain abdomen, either in the right hypochondric region, etc. That is not being present. Sore irritation is being absent. Then burning micturition is absent. Burning micturition, that is ruling out the urinary system disease as such. Loss of strength, that is ruling out the nervous dysfunction. Joint pain, to rule out musculoskeletal diseases. Itching sensation in the skin or discoloration of the skin, to rule out the integumentary diseases as such. This is how we are going to write the case history. In other words, this may be the template that can be put for. Patient was apparently healthy since so and so days or months or years, has suddenly developed or gradually developed or insidiously presented with chest pain since so and so days, which is located in the actual area of the body where this is being present, radiating or non-radiating, or pricking type of pain, or burning type of pain, or pulling type of pain, or squeezing type of pain, etc. Of dash in severity, mild, moderate, or severe in severity, which is improving or worsening or persistent, getting aggravated by the aggravating factors and getting relieved by the relieving factors, and the patient is not having the, that is documenting the negative history. If the person is not having the pain in that particular situation, this may be a probable template that can be used. Patient was apparently healthy since so and so days, months or years, suddenly developed or gradual or insidiously developed vomiting since 3 days. This is severe in severity. So that means after taking the medication, this particular vomiting is not getting subsided. Persistent throughout the day 1 till the present day is of same severity, aggravated by consuming spicy substances, getting relieved by antacids or antiemetic drugs, and negative history. No history of fever or yellowish discoloration, etc. No history of fever, excluding the infective diseases, and yellowish discoloration, excluding the hepatobiliary system involvement. Regarding the one more example, let me put forth. Suppose if the person is having the pain abdomen since n days, vomiting since n-2 days, then this may be another way of writing the case history. First of all, regarding the first complaint, patient was apparently normal since n days or months, is gradually presented with pain in the epigastric region, radiating towards the retrosternal region, which is of burning type, moderate in severity, persistent, aggravated by consuming spicy substances like gobi manchurian, pakoda, etc., and getting relieved by consuming milk or warm water. This is first presenting complaint. Second presenting complaint, that is as an associated complaint, patient gradually developed vomiting since n-2 days, which is moderate, persistent, getting aggravated by consuming spicy substances and getting relieved by taking warm milk or antiemetic drugs. And afterwards, negative history. No history of yellowish discoloration of eyes, stools to rule out hepatobiliary disease, loose stools to rule out lower alimentary canal dysfunction, burning maturation to rule out the urinary system dysfunction, and fever to rule out infective situation. So, the take-home messages from today: history of present illness is one of the very important part of case taking, which is documented after documenting chief complaints. As we have discussed, chief complaints should be in patient's main own words. That should be mentioned in the chronological order, and each of the presenting complaint has to be detailedly evaluated based on the onset, duration, severity, course of the symptom, aggravating and relieving factors, and negative history. If the person is having the pain, then onset, duration, location, radiation, character of the pain, severity, course of the symptom, aggravating and relieving factors, and negative history has to be evaluated. That's all for today. Dear ANA members, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you'd like to have discussion in the coming days? Mention in the comment box below. And if you're liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.